Have you ever gone to your dentist begging for a root canal? I have, 3 different times. The 3rd time I showed up, my dentist refused to treat me. Instead, she referred me to a neurologist who diagnosed me with trigeminal neuralgia. Before my diagnosis, I had never heard of trigeminal neuralgia, but since then I've done extensive research on the condition. Knowing the signs and symptoms of trigeminal neuralgia could help someone receive a correct diagnosis in a more timely manner than what mine was. Today, I will tell you about what trigeminal neuralgia is, its causes and triggers, and the treatment options in the past, present, and future. Trigeminal neuralgia is a neurological condition that causes extreme facial pain. Let's begin our examination of trigeminal neuralgia with a look at the physiology of what causes the pain. Duke University Medical Center explains that trigeminal neuralgia comes when there's damage to the trigeminal nerve root at the base of the brain. The National Institute of Neurological Disorders and Stroke lists 2 main causes for this. The first one is compression of the nerve, caused by a tumor or an arteriovenous malformation, which is a tangle of nerves and blood vessels that presses against the nerve. The second is erosion of the myelin sheath, which covers the nerve, much like insulation over an electrical wire. The second cause can also be caused by multiple sclerosis, which wears away the myelin sheath. The trigeminal nerve at the base of the brain has 3 trigeminal nerve endings on either side of the face, and patients can be affected with pain in 1 or more of the nerve endings. However, it's usually only on one side of the face. Let's recap. Trigeminal neuralgia is a painful neurological condition which is caused by 2 types of damage to the nerve and causes extreme facial pain. Now that we know the physiology behind how trigeminal neuralgia is caused, let's focus on the pain itself. There are 2 different types of pain that trigeminal neuralgia victims feel. The International Journal of Clinical Practice says that the first is kind of an aching, burning, throbbing pain. The second is a more acute, sharp, stabbing pain. And patients can feel this pain separately, together, or intermittently, either, or both. However, eventually, the pain and the attacks will get closer and closer together and increase in severity. Dr. Wolfgang Littke, a trigeminal neuralgia researcher, says that trigeminal neuralgia can cause some of the most devastating pain that humans can suffer. And this is devastating not only because of the pain, but because the triggers are parts of everyday life. Speaking, eating, chewing, kissing, putting on makeup, shaving, brushing your teeth, cold and wind are all triggers for trigeminal neuralgia pain. And not only are the triggers the problem, but even the fear of causing another attack can interfere with victims' normal life. Now that we know the physiology behind trigeminal neuralgia, know the triggers and the pain that it causes, let's look at the treatments, because there is no cure. In the past, treatments were dangerous and ineffective. The Journal of Neurosurgical Focus lists several of the cures from the past. And for reference, you need to know that analgesics and most opioids have no effect on trigeminal neuralgia pain. So in the past, all sorts of dangerous chemicals were tried, usually in combination with large amounts of alcohol. Some poor souls got nothing more than laxatives. These treatments were thought to be effective if blindness, blackouts, or paralysis occurred. Unconsciousness was a way to stop the pain. Dr. Littke also reported that if there was no relief to be found, many who suffered chose the only way out they could and killed themselves. Today, medications are the first line of treatment for trigeminal neuralgia. Anticonvulsants and tricyclic antidepressants are the drugs of choice when managing the pain. However, after a time, the drugs become less and less effective and eventually stop working. That's when it's time to turn to surgical options. There are 2 types of surgery to deal with trigeminal neuralgia pain. The first removes whatever is causing the compression, the tumor or the arteriovenous malformation. The second goes in and puts a cushioning sponge where the myelin sheath has worn away. Surgery itself, however, is only effective for 3 to 15 years. If the patient is lucky enough to be healthy enough for surgery, it can be repeated. In the future, treatments could include such experimental things as Botox treatments and electrical shock therapy that interrupts the messages to the brain. As we have learned, trigeminal neuralgia is a painful and progressive neurological condition with no cure. With the amount of information I've shared in these few minutes, I could have been saved 3 years of pain searching for a correct diagnosis and treatment. In conclusion, most people are unaware that trigeminal neuralgia even exists, that it's caused by damage to the trigeminal nerve, that there are several viable treatment options, and that we should be concerned about those who have it. Perhaps the knowledge you have could someday help someone else. Perhaps with continued public education, trigeminal neuralgia will never again be known as the suicide disease.